A clinical placement is one of the most important parts of an undergraduate degree in health. Essentially, it gives a student opportunity to link theory into practice in a meaningful way. So essentially, they're learning to think like a clinician by doing what a clinician does.
I've been able to take on a caseload, work with patients, and really learn to develop interventions on my own as a student.
I've had really good opportunities to work across a number of wards, and both in the inpatient and outpatient setting.
Clinical placement is an opportunity for students to come into the workplace, to practice their skills on real patients with real x-rays, and it's something that cannot be done at the university.
And so by getting those hands-on experiences through placement will allow students to build their core skills that they'll need when they're actually working as therapists.
Anywhere where a clinician works is a potential clinical placement partner. People who work in community health, NGOs.
Whether it be public hospital or private practice, as long as they offer a wide variety of examinations, a wide range of patients, as well as appropriate clinical supervision. You are having an input into the development of future work colleagues.
Being a supervisor here of students at Westmead, I find it to be very fulfilling. I like to work with the students closely and watch their development in the time that they're here.
Students can be an asset to your workload.
Obviously, students will be helping their supervisors with their clinical loads, running clinics to help with waiting lists, helping with resource development or refining existing resources that we have.
You have an extra pair of hands.
They can do a lot of what you normally do on a day-to-day basis.
And also, often they come armed with new innovative ideas that we take on as well.
It keeps you up to date with emerging technologies. It keeps you up to date in your profession about what's being taught at the university level.
And just seeing that development and progression whilst they're with us is really rewarding as a supervisor.
Placements are a really great opportunity for you to learn to develop your skills in a really safe learning environment.
One of the things I do love about student placements is the fact that I get the opportunity to mould somebody's professional career in terms of their clinical reasoning and in terms of thinking like a clinician.
It's been very challenging, but it's been an amazing placement and I've loved every single minute of it here.
Clinical placement is so important because it links the university with our profession today and what we would like to see our profession look like in the future.